Hello and welcome to the Imaging Wire Show. My name is Brian Casey. I'm managing editor of the Imaging Wire. Got a great episode for you today. We'll be talking about new technology for enterprise image exchange. And our guest is Rishi Nayyar. He is co-founder and CEO of PocketHealth. Rishi, thanks for being with us today. Can you tell us a little bit about yourself and a little bit about PocketHealth?
Hey, Brian, thanks for having me on. Always a pleasure to be on the Imaging Wire. PocketHealth, we are a cloud platform with a focus on the intersection of enterprise image exchange and patient engagement. We've been building the company together. I'm the co-founder and CEO for coming up on 9 years now. And we've been able to grow from what was my co-founder being handed a CD and this idea that we could build something that existing digital image exchange solutions weren't able to build, to solve, to make imaging actually flow seamlessly, initially directly to patients only, and build that into a platform that enables image sharing across some of the largest healthcare systems in the United States and in Canada, and as well integrate a layer of AI that helps patients actually understand their care and stay in your healthcare system. And that's really been our focus for over half a decade now at PocketHealth.
All right, great. Now, this issue of patient image exchange and enterprise image exchange is so important because it's a way to get patients more involved in their healthcare. It's a way to keep patients informed about what's going on with them. And a lot of the legacy solutions for doing that are almost like 20th century. I mean, can you talk about some of those? And can you talk maybe about some of the challenges that healthcare providers face in navigating some of these legacy technologies?
Yeah, the reason why this hasn't worked in the past is legacy technologies have traditionally been network-based. Network-based meaning they follow a hub and spoke model, where the idea is that if I can go to where the imaging was made, where the actual MRI was taken, the healthcare system, make that the hub, I could then add spokes all around, and then imaging can flow seamlessly there. The actual issue is that, like most systems, like a weather system or like file sharing anywhere outside of healthcare, it's extremely complex. And when you have an extremely complex system, it's on paper you can draw all of the spokes and it's very clean, But in reality, given how interconnected healthcare is, given that you actually often don't know where imaging needs to go at the time of you setting up your image exchange or even seeing that patient, it becomes an intractable problem, and you're burning CDs to fill the gaps. So the impact on patients is something that I think that anyone who's been through some sort of medical experience can associate with. You're by definition sick. You or a family member are picking up CDs. There's repeat radiation. There's a higher risk of missing a medical mistake. There's inconsistent communication, and then on the provider side, there is no big CD cartel. Like, nobody wants to be burning these CDs, but they have staff members dedicated to that. They spend a lot of time with their legacy image exchange solutions, trying to convince others and really be the salesperson to try to get other people to install those so-called spokes. And I think that's led to a lot of budgetary problems, P&L problems, a lot of patient impact. It leads to a lot of patient leakage going outside of the system, which isn't great for the patient either. And then it leads ultimately to just a lot of frustration with the, I would say, traditional options to remove CDs.
Yeah. No. So we're talking about CDs here, and this is 2024, and CDs anywhere but in healthcare, using CDs is almost become a joke. I mean, they're just like coasters. But healthcare providers are still using CDs. That just blows me away.
They really are. What many healthcare providers have done, who have invested, sometimes in the order of millions over a long contract into a legacy image exchange provider, is that they have been able to reduce their CD burning, but not eliminate it. So they've invested a lot into getting their sister sites up on these legacy image systems, which are being consolidated, moved around, maybe not maybe not supported to the level that a complex system needs to be, with the sister sites having their packs change all the time and everything like that. So, and CDs have to fill all of the gaps. And that's just been what I would say is the accepted status quo. We heard a quote from a very large health system recently, who said, look, we would love for PocketHealth to reduce our CDs. By the way, we think eliminating CDs is impossible by anyone. And I think that was a bit sad to hear, because we've proven that we can eliminate CDs 100%, and we don't have to have a reliance on them to fill the gap.
Yeah. Now, what are some of the challenges that using these legacy technologies create for patients? I mean, I know that if I went to a healthcare provider and they gave me my images on CD, I don't even know how I'd play that. I'd look at them. I'm not even sure that I have a computer that has a CD drive anymore. So what does this do for patients?
Yeah, for patients, either they're getting a CD, or in some cases they're getting what is really a legacy portal. So either they're getting what I would say is like a JPEG in the MyChart, which is not diagnostic access. It doesn't replace the role of a CD, because no one externally can download the DICOM imaging from there. A physician can't view on that and make a diagnosis on that. Or they're getting access to a portal where the sign-on experience is extremely challenging. We have to remember that the average patient is not very tech savvy at all. Or they're getting one where sharing with physicians is extremely challenging, and you run into the exact same problem where for a patient to share with the physician, they need the physician to be on that platform. They need a share pane, which they need to share in a separate way. What I'm trying to say is that this is really a solution that was built on how can I just check off a box and get patients access, as opposed to one that is built like a true consumer application that we use on our phones every day, being like, what is the user experience to make a patient actually want to use this, be able to use this, and their physician, instead of going back and asking for a CD. And the knock-on effects we spoke about earlier, lack of communication, lack of care coordination, increased risk of medical mistakes, and the list goes on and on.
Yeah. So PocketHealth was founded to address some of these challenges and some of these issues. Can you talk briefly about the origin story of the company and kind of how you guys came about?
Definitely. I joke that we are a family business. So my co-founder is my brother, and he's also our CTO. He was actually in Silicon Valley at the time. This must have been around 2013, and he was playing tennis. We are not a very athletic family. He tripped, sprained his ankle pretty badly, and then he went to see his physician in Sunnyvale, who said, "Look, let's get an MRI and an X-ray to see if this sprain is something worse." He went to a clinic there in Sunnyvale, and they handed him a CD at the end. And that really it was this juxtaposition of, you're in the heart of global tech with Netflix up the road and YouTube down the road, and yet this information that he wanted to see, his physician needed to see, was burned onto a CD that his MacBook Air couldn't even ingest. And that was really the spark. Our belief was that when we spoke about it that night, when he called me really upset but excited, we felt that, look, we can solve this problem, but we knew fundamentally that nearly every care journey began with a patient image. So we felt that if we could solve this problem, give patients access, make image sharing more seamless between providers, we could have a real shot at building a much deeper patient engagement solution that could keep patients more informed of their healthcare, help providers keep better track of what's happening, create greater patient retention. We felt that you could build what we felt was a generational healthcare platform by solving this one problem that no one was spending any time solving, at least earnestly solving, which is like, how do patients get access to this information? How do other providers get access to this information?
Now, can you talk a little bit about how you work with the healthcare provider? So you go in, they're using legacy technologies, and they're possibly using CDs. So you go in and what happens then?
What we do is we implement PocketHealth. It's a fairly straightforward implementation. implementation, we leverage what you would expect, traditional APIs, both to the PACS, the EMR, and any other systems where we need to gather the data for the image exchange platform to work. Often we're implementing directly into the EMR for, whether it's into the Epic pie chart or the Cerner patient portal, or even inside the GUI of these different systems. And then what we're doing is a big focus is change management. So here we have systems that have spent a lot of time working with legacy image exchange platforms because those were the only options. And now they're bringing in PocketHealth to replace all of these quote unquote spokes, all these physician portals with PocketHealth versions. And we're able to do that very seamlessly. We're also able to connect, to other image exchanges. We believe that image exchange should be interoperable, and we focus on that, meaning if we have a customer and someone else is using another system, we should be able to talk to each other, and we are able to talk to each other. Luckily, DICOM is this universal language, and we all stand on the shoulders of that great progress in protocols and standards. So we really do focus on that operational change management to get them to zero CD and greater patient retention.
Right. Now, after you've come in and after you've implemented your technology at a provider, what sort of efficiencies do you see there?
What we're really seeing is, it starts off with qualitative and becomes quantitative. Qualitatively, immediately, you're having a lot of buzz among the staff members. There's a lot of excitement, feedback from patients that's very positive, and then the data starts to come in. So typically within a month or so, the site is at 100% zero CD, meaning they've shut down their CD burners for all cases, everything from legal to patient to sending to another provider. They shut down all of their CD burning. We sometimes ask them to send us an email when they do that, so we can keep that in the log, and we try to get that time shorter and shorter and shorter from go live. And then typically around 6 months to a year out, you can start to do some really powerful financial analysis where we have providers that are saving, I would say at a minimum, hundreds of thousands of dollars a year, but often when you add up the staff time saved, the increased patient retention, we're talking about millions of dollars when we think about P&L impact. That does take at least 2 quarters to measure, often more. You want to be honest about gathering the data in a way that is defensible, but that's when you can start to really see this efficiency for providers start to happen, and the great feedback. We've never lost a hospital client in our nearly 9 years of operation. So I think that speaks to the impact that we're able to drive for our customers.
Yeah. Now, in terms of the impact of patients, I can imagine that if a provider implements your solution and their patients are more, it makes patients more engaged with that provider. It makes them happier. What sort of outcomes are you seeing in terms of patient retention with your clients?
What we see is that over 80% of patients who interact with PocketHealth specifically, as opposed to a previous solution, whether that's CDs or some other system, are much more likely to return to that provider and also recommend friends or family. And depending on the site, that number bounces between 85 and sometimes close to 100%. But what we're talking about is the overwhelming majority of patients who interact with the platform notice it, understand the differentiated care, and when asked directly, do say it influences their behavior in terms of whether they're more likely to do. And we ask specifically future imaging, not just related engagement, not just because their family physician is there, but future imaging where they actually do have a choice with that requisition to go anywhere. They will go back because they want to maintain their access on PocketHealth. They appreciate this additional AI layer that helps them understand what's actually happening in their platform and their body. And that's something that they really can't get anywhere else.
So given the investment in new technologies and managing compatibility with existing systems and the need for training with new implementations like this, how does PocketHealth support implementation and success at some of your clients?
It really is a full court press between our operational implementation teams and our technical implementation teams. We have a fundamental belief that is shared by a lot of, I would say, top technology companies outside of healthcare, that you can't just install the software and expect the software to be quote unquote so great that it'll just work on its own. In enterprise software, that's not how it works. These are massive ships. We have clients that employ tens of thousands of employees, and turning that ship onto a new platform is a massive effort. So what we do from day one is, yes, we focus on getting that the technical integrations up and running, going through testing and making sure that an image, when prompted, goes from where it needs to go in the way it needs to go at the speed it needs to go. But while that's happening, we're spending a lot of time building a list with our clients, saying, okay, what are the external sites that are using your legacy system that we need to put a PocketHealth community gateway in, and we start engaging with those sites early. Not asking our clients to be the salespeople, but ourselves going out and educating these external sites on, hey, XYZ is now moving over to PocketHealth, and we're now ready to install a community gateway, and we have lots of options. If that external site isn't quite ready for that jump yet, we can still have full bi-directional image sharing there. So that, from staff training to lunch and learns to building custom assets inside the hospital, from CD stickers on the floor that says, don't ask us for a CD, get PocketHealth, and everything in between. We really think that we keep winning business aggressively because of our reputation for efficiencies that we build inside the health system. And you only get that if you play a very involved role. The product does not speak for itself. Enterprise products do not just speak for themselves. The entire package, which is the support you get, the implementation support you get, the business development support you get, all of that comes together. And we could say that if that is the product, then that definitely speaks for itself.
Very good. Let's talk a little bit about the company's evolution. Can you talk about how PocketHealth's footprint has expanded over the last couple of years?
Definitely. We've grown pretty rapidly. We've grown from one clinic in just outside of Toronto, Canada, to over 800 of the largest hospitals and imaging centers across North America. We have some fantastic large clients like MedStar, Nuance Health, UC Health in Cincinnati, all the way to local imaging centers where, that critical care that often happens close to home, and everything in between. We believe that we're on track to implement PocketHealth in one way or another, implement a PocketHealth solution in every single large health system over the next few years.
Wow, that's amazing. Now, one of your lead products is Report Reader. Can we talk a little bit about how Report Reader has evolved?
Yeah, it started from, we do all of our own support. That it's important for us that patients are not directed to a call center, or clients aren't having to do that patient support. And in the early years, one of the most common things that patients would call about is, what does this mean in the report? What does that mean in the report? And that could mean before their appointment with their physician, after their appointment with physician. We actually didn't see a difference in the level of, you could say, confusion or understanding. So we felt that, look, we have the ability here to, within safety guidelines, and in a way that we felt was comfortable, was collaborate with our own physician partners that we source from our own clients, and build software that actually helps patients understand their reports more deeply, from translating specific terms into patient-friendly language and going much deeper. And now, since Report Reader launched, I think we're coming up on 2 years ago, we've now expanded it to really what this entire platform we call My Care Navigator, where we built a very, very robust follow-up detection model, where patients are actually able to see follow-up recommendations by their radiologist. We're able to identify eligibility for additional screenings, whether that's breast screening, whether we detect low bone mineral density, and they should be getting a DEXA scan, for example. And we even give them questions to ask their doctor to prompt more healthy conversations with them and their referring physicians. So Report Reader was really that first tiptoe into, can we add more analysis here to make the patient's life easier? And we've now really, really pushed hard in that direction, and the patient experience is really been transformed over the last 2 years.
That's a great idea. Now, what are some of your other key products that you've introduced in the last couple of years? I guess you've got something called appointment reminders.
Definitely, we have this belief that for our patient engagement solution to continue to really push the envelope and how much guidance can we give patients and how much retention can we drive, we felt that we need to actually start before the appointment, and no shows. Even with most health systems having some form of digital appointment reminder, they often weren't customized enough. They weren't at the frequency they needed to be. And by frequency, I mean by service line or by procedure differing. It didn't have appropriate prep instructions. And we felt that there was an opportunity for us to really reduce no-shows, but improve adherence as well to these to the steps that patients needed to take before their imaging appointment. So we launched appointment reminders. We've been able to, in our implementations, which vary from very large hospitals all the way to imaging clinics. So we reduce imaging reduction by an average of no-shows by an average of 32%, which is pretty dramatic. And we're doing these measurements typically within a month and a half, 2 months. So we expect continued improvement as we continue measuring, and obviously significant staff time where they're calling all of these patients traditionally, and now they're not having to do that work. We've also launched auto routing and community gateways, where we're now able to put a PocketHealth community gateway and a software connected to any PACS anywhere for no cost, and connect that to the entire system. So while we are a platform that believes that no network sharing is how images should move, we know that there's certain times where a network makes sense. These mini regional networks that we stand up in various regions across the United States, and we've invested a lot of time into building a really great community gateway experience.
Great idea. Now AI has been such a hot topic in healthcare and radiology. Is PocketHealth leveraging AI in any way to enhance patient engagement?
Definitely. On the patient engagement side, we use AI both at the education level and the action level. So on the education level, we use a report reader. We're giving them, analysis around different screening options based on the actual images themselves. We're also built as I mentioned, a very sophisticated follow-up model that is both patient-facing and provider-facing to tackle this problem around follow-up adherence that is a very hot topic these days in radiology. And then we also, on the action layer, we help patients actually know what to do next with their healthcare provider. So as I mentioned, often that means going back for further imaging with the follow-up that we were able to detect using our models, or really just having questions to ask their physician. And I would say a tremendous focus within our patient engagement product team is to continue to leverage AI to help patients understand their care better, understand what's happening better, and have them engage more deeply with their healthcare system.
Now, what are some of the technology focuses that you guys are going to be really looking at in the next couple of years when it comes to image exchange and patient engagement?
We believe image exchange should be dramatically more automated than it is today. And we think that AI can play a massive role there. We're not just talking about work lists. We're not just talking about ingestion, though those are areas where AI can help significantly, especially in terms of patient matching, but also just understanding and prompting that based on previous behavior, where should images be routed next and in the future. And that can turn image exchange from a manual process like it has been traditionally with legacy image systems into one that is significantly automated, eventually perhaps entirely automated with just an audit trail in the background. And then we also feel that on the patient engagement side, we can continue to really push the envelope in terms of giving patients access to tools that their healthcare providers, our clients, approve of, support, and that let them understand what's happening. We know that patients appreciate that experience. This is often the data that diagnosed them in the first place. So it's critical information for them to understand better and for them to realize the role that their healthcare provider, their imaging provider played in helping them understand what to do next and have a healthier conversation with their physician.
Now, if there's a healthcare provider out there that's using a lot of these legacy technologies and using CDs, what sort of advice would you have to them as they go out and look to implement a more modern image exchange solution?
I think if they're ready for a change, what they really should be doing is looking at what's not working now and going outwards. Generally, there's table stakes technology. Can you, if I have another site that's willing to install something, can I push images there? Of course, everyone should be able to do that. I would say when you're building an RFP or you're looking for what to implement next, focus on what is currently not working, and then also be open to what can the future look like, and ask your vendors that. Ask your vendors that, look, this is a 5-year commitment, maybe a 10-year commitment, and where are you taking me? And that can be beyond image exchange. That's perfectly fine. But where are you taking me that's worth it for me to invest in this technology? Because this is not the same as getting a robotic CD burner where you're just going to pick one. And the way that this pace at which radiology AI is advancing means that if you pick the right vendor, they can solve a tremendous amount of problems for you down the road. Ones that seemed not even possible to be solved prior to some of these foundational technologies in AI that built up over the last couple of years, and then it's a missed opportunity to not really focus on getting a vendor who's future proofing you.
Very good, some great advice. Well, I'd like to thank Rishi Nayyar of PocketHealth for being with us. Rishi, thanks so much for your time. We appreciate it.
Brian, thanks so much for having me, and have a great day.
Thank you. All right, signing off for the Imaging Wire, my name is Brian Casey.